Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that we are making the series that is Ayurveda in General Medical Practice or Ayurveda in GP. Today we are going to discuss a very common problem of many people, that is a headache. A lot of people, I think very few people on this earth are there that who do not have experienced headache at any time in his life. It is very difficult because there are so much stress and so much anxiety, so much panic, so much tension, so much hot temperedness we are, that we are going to get this type of headache, maybe because of the even sound pollution or air pollution and all this and that things. So headache is very common, but I will request that most of the people like to take the Crocin tablet, 500 milligram, or Crocin tablet, 650 milligram. Some go for the Combiflam tablet, that is paracetamol with ibuprofen. Some people, they go for the lap application of the Amrutanjan or even Chandanadi lap. So many things are there. Some try to do the Ayurvedic type of the management like Nasya and all these things. Also, some like to take the Shirodhara for the sleeplessness or the insomnia, because headache can be having a multiple reasons. And I will request you, even some people they go for example Parthadhyarishta or the Shirashuladi Vajrarasa from the Baidyanath company. Okay, I am not denying the importance of these medicines, but what is the most important? Don't, if the headache is continuous, unbearable, and coming for months together, continuously or intermittently or years together, my dear, all the students or maybe any viewer, please don't neglect headache as a casual. Huh? Unless and until it is diagnosed that yes, it is only migraine, yes, it is because of the viral infection, then it is okay. But if you are going to take paracetamol, Crocin, Combiflam years together, and all of a sudden, when it is a non-stopping and continuous, then you visit to the neurologist, physician first, and then neurologist, and neurologist they do the MRI or the CT scan, and they found that there is a growing tumor in the brain. I am not afraiding you. I am not afraiding you. But remember, headache for years together should not be just tackled by taking the Combiflam and Ayurvedic drugs. Better, you should inform to the at least family physician, and if at all required, you don't hesitate to do the MRI or CT scan in time so that the serious conditions can be ruled out. Okay, so let us talk about the headache. But according to Ayurveda, any pain, remember my words, Ayurveda says it is because of the Vata Prakopa. There are three bioenergies: Vata, Pitta, Kapha. Vata is responsible for all types of movements. It may be the nerve impulse, it may be the heartbeat, it may be the lungs, inspiration and expiration. Movement is a Vata. And pain is related with the pathological side of the Vata dosh. Whenever there is a Vata Prakop, always you will get the headache. Simple thing I will explain. If headache is because of their Vata Prakop is of two types. Vata Prakop. Dhatu Kshayajanya. Oh, sir, Kai, what you are talking about Sanskrit and all these things? Dhatu Kshayajanya is because of the weakness, debility, deficiency of the dhatus, deficiency. Ayurvedic, Rasa Rakta Maus Med Asti Manjach. You may be anemic, you may be low weight, you may be less immunity. So that is Dhatu Kshayajanya Vata Prakop. And another is because of the toxins inside your body. Arm is there. If you have the indigestion, constipation, gas in the stomach, then that is Vata Prakop is Marga Varodhajanya. Try to understand these two things. I will simply give you one interesting test. But for that interesting, how to diagnose Dhatukshayajanya Vata Prakop or Marga Varodhajanya Vata Prakop, that we will discuss at the end of the video. So I request, please go and see till the end and see what Dr. Deshpande is mentioning about the Dhatukshayajanya Vata Prakop, how to diagnose, and Marga Varodhajanya, how to diagnose, and what to do in that case. Okay. So let us talk about the Shirashula in Ayurveda, intracranial and local extracranial causes. Cranium means brain, this brain cavity. Trauma is the common cause, contusional or post-traumatic headache, head injury. Then intracranial inflammation. Meningitis is a very serious Please, and it is very common also, especially in the children around the age of 10 to 15 years. All of a sudden, they get a very, very, very high fever, 102, 103 degrees Fahrenheit, like the very hot to touch. Then severe headache will be there, severe bursting headache, vomiting will be there. Try to understand. And then there is two signs. One is called as a neck rigidity. You cannot bend the knee, bend the neck. It cannot touch. This chin cannot touch over here. This is called as a neck rigidity. Meningitis sign I am talking about. And second is a Babinski sign. For example, this is my feet, plantar aspect, and doctor will touch this clinical hammer, and the normally finger should be like this, but in this case the finger will be fanned out. So this is a diagnosis of meningitis, and meningitis should not be treated by a family physician. The patient must be admitted in the hospital. So this is a serious cause of the headache, meningitis, and is common. Encephalitis, then cerebral abscess inside the brain. All these are brain. Vascular headache. Migraine is common. There is a tendency in the people that they get the migraine attack, especially the people having Vata predominant or Pitta predominant Prakriti or Vata Pitta predominant Prakriti, they get this type of attacks. There may be a stimulus, like for example, too much sound around them. When they go to the crowd, when they are hungry and moving, traveling a lot, and that all the things they get a migraine attack. Then hypertension. Please, in each and every headache patient, you should get checkup of your blood pressure always. Normal is 120 by 80 mm of Hg. 120 is a systolic, 80 is a diastolic. And hypertension is diagnosed on the basis of lower diastolic. So when 80 is to 90, mild hypertension. Up to 100 diastolic, moderate hypertension. Always above 110 degrees, mm of Hg, that is a malignant or serious hypertension. So you must take care of hypertension in headache cases. Cerebral or subarachnoid hemorrhage, bleeding inside the brain, intracranial tumor, aneurysm, then vasodilator drugs, for example, nitrites or the histamine. If somebody is receiving the adrenaline, menopausal, alcohol hangover or withdrawal, coffee withdrawal, superficial temporal arteritis, thrombosis of the intracranial venous sinus. These are the cranial causes. Now, extracranial local causes here around. Soft tissue, for example, furunculosis or cellulitis here of the skull, hair root infection, then myositis of occipitofrontal muscle, then vigorous head movements, like by some your what you can say the event, you have to move your head. That can also cause the stress to the head. Contusion of the skin or subcutaneous tissues of the skull, skin of the head. Bones and sinuses, periostitis, then middle ear disease, very common, middle ear disease. Sinusitis, very common cause of the headache. The cuff is saturated in these hollow spaces, hollow bony spaces, that is sinus. Hollow bony space, sinus. Frontal sinusitis, maxillary sinusitis. Okay, vacuum headache and craniostenosis. Next is increased intracranial pressure, like tumor may be there, guma, cyst, hydrocephalus, hemorrhage. Decreased intracranial pressure like hypotension after lumbar puncture. In some surgeries, they give the lumbar anesthesia or the spinal anesthesia. So after spinal anesthesia, some patient may get the headache. Okay. Then dehydration is one of the cause of the headache. Cough headache, a benign syndrome of severe headache with accompanies the if lot of bouts of cough, then you will start the headache. General or systemic causes, for example, anoxemia, that is the less oxygen because of the anemia, because hemoglobin is carrying the oxygen. If your hemoglobin is below 10 gram percent, that is anemia. Normally it should be 12 to 14 gram percent. Please check your blood to rule out the anemia. Of course, we are going to see the investigation. Carbon monoxide or carbon dioxide poisoning in air pollution, toxic, fever all the time. Whenever there is a fever, you will get the headache. Uremia is a kidney problem. When urea is not thrown out because of the kidney problem, it is stagnated in the blood and urea is raised in the blood. That is called as a uremia. Amia means blood. Remember this thing. Then eclampsia is a problem with the pregnancy. If the pregnant lady is having the edema, pedal edema, or the face edema, check the urine, check the blood pressure. If urine is showing the proteinuria or albuminuria, if the BP is also high, then edema, albuminuria, and high BP is called as a pre-eclamptic condition in the pregnancy, and it's very serious. It's also called as a toxemia of pregnancy, and that can affect the child growth, or it may cause the miscarriage or the abortion. So in pregnancy, you have to be careful whenever there is a headache. It should not be because of the eclampsia. Then metallic poisoning, alcoholic hangover, post-convulsive drugs like the quinine, tobacco, cocaine, morphia, sulfonamides, pelvic or the gallbladder diseases, constipation. Remember this thing. So whenever there is a vata problem, Vatanuloman should be there. I request all of you, please keep Triphala Ghanavati tablet at all the time in your home. So whenever little bit here and there constipation, at night you can take Triphala Ghanavati 2 tablets with the warm water. Okay, very simple remedy, but that is very useful because Triphala is also rasayana. Intestinal stasis, nervous exhaustion, lot of work in the office, tension, headache, very common. Then metabolic factors like hypoglycemia, blood sugar is becoming low in the diabetic patient when they are dependent on insulin and not eating very well, that is a hypoglycemia. Alkalosis or acidosis, then neuritis and neuralgias of sensory nerves of the skull, for example, orbital neuralgia or neuralgia of the auriculotemporal, posterior auricular or great occipital nerves, herpes of the ganglion. This is very rare. Then reflex causes, these are most important. Ocular causes, error of refraction in the children. Whenever the children of school-going child always, whenever complain of headache, don't miss to visit to the ENT surgeon and ophthalmologist, because they will try to find out whether there is cause in the ear or whether there is a eye problem, vision problem. Then glaucoma is a very serious disease. Glaucoma in the adult, in the big adult person, matured person, all of a sudden they start severe, either right or left, very severe pain over here, very severe pain, very severe, unbearable pain. And all this headache is there, and he will see the blurred objects. So glaucoma is a intraocular tension is raised. Immediately visit to the ophthalmologist or the eye surgeon and check your eye tension. There is a tonometer and they can check your eyeball tension. Okay. Then iritis is also serious. Ear problem, otitis, that is a discharge, pus discharge from the middle ear. Mastoiditis, this is a bone mastoid. When from the ear infection, if otitis media is not properly treated, the infection will go into the bone, and from bone it will reach to the meninges, and that is very dangerous. Eustachian tube block. Eustachian tube is a tube from ear to the throat. The tumors of the middle and internal ear, teeth, even the caries tooth can cause your headache. Remember this thing. And psychogenic due to stress. Tension headaches due to stress and strain are very common. Next, what you can do, first is ophthalmic checkup, second is the ENT checkup, dental checkup, CSF examination to rule out the meningeal irritation, especially meningitis, blood sugar level to rule out hyper or hypoglycemia, blood urea to rule out the uremia. Treatment, what can be given? Rule out the cause and treat accordingly. Sankhepatah kriyayogo nidana parivarjanam. For migraine and tension headache, symptomatically you can give Chandra Kalaras 2 tablets 3 times in a day, Pitta Shamak tablet, Sutta Shekhar or Laghu Sutta Shekhar. But Sutta Shekhar is a drug for the acidity due to the indigestion. Remember that thing. 2 tablets 3 times in a day. Jatamansi is a tranquilizer, anti-anxiety, stress management. Jatamansi churna 200 milligram 3 times in a day with milk. Then Anu Tailanasya. Always in the headache cases, we give the 3 types of treatment. The Nasya is always recommended. Shirodhara is also recommended. There are 3 types of the things that we do, but one answer I want to give you afterwards. Let us wait. Anu Taila. Okay. Then further, next prescription for headache, Shirashula. Shirashuladi Vajra Rasa from Baidyanath Company. 2 tablets 3 times in a day, especially for migraine. Mahavata Vidvamsana 1 tablet 3 times in a day. Then Pathyadi Kada 4 teaspoons with equal amount of water 3 times in a day. Next, prescription, my dear friends. Whenever there is a mental stress, Brahmi Vati is the best. 2 tablets 3 times in a day. Siladin from Allersin company, 2 tablets at bedtime. Tranquilizer, anti-stress. Gandharva Haritaki is laxative. 1 teaspoon with warm water at bedtime to make the defecation very proper. Godanti Bhasma, that is a Pitta Shamaka. Ayurved Seva Sangha Nashik, 2 tablets 3 times in a day. Next, prescription, my dear friend. Many prescriptions by Professor Deshpande. Suvarna Makshika Bhasma, whenever there is anemic condition and headache, 2 tablets 3 times in a day. Tranquinil Charak Company, 2 tablets 3 times in a day. Siladin from Allersin Company, 2 tablets 3 times in a day. Next prescription, that is a CFAC grain from Charak Company. CFAC grain, 2 tablets 3 times in a day. Shirashuladi Vajrarasa, Baidyanath Company, 2 tablets 3 times in a day. Pathyadi Kwath or the Kadha, 4 teaspoons with equal amount of water. Then Saptamrita Loha, especially when there is ear infection, don't forget to use the Saptamrita Loha. Be regular in diet, sleep, and have enough rest. Keep away from the direct sun or overthinking. My dear friends, I was talking to you in the beginning about the headache. Do you remember? And I say Vata Prakop is the main cause. Whenever pain in the body, like body ache, leg pain, headache, whatsoever, pain is related with the Vata Prakop. So we have to avoid the Vata Prakop. So there is a 2 types of Vata Prakop, Dhatu Kshayjanya and Margavarodhajanya, that is obstructive phenomena. When there is a Dhatu Kshayjanya, for example, if whenever many people they do the tightening of the some cloth strip over here and make tight this type of the bandage, cloth bandage on the head to relieve from the headache. If you tight that particular bandage and your pain goes off, that is definitely Dhatu Kshayjanya Vata Prakop. Remember this condition. And then you will need some, what you can say, the strengthening type of the medicines. You check the anemic condition. You should take the tablets which will increase your immunity, which will increase your iron content of the body. Like, for example, simple thing I will tell you, you can do the Bala Ghanavati for a long time, 3 months or 6 months. Bala is a plant, Sida cordifolia. It is strengthening to your body. Then what you can do the Shirodhara. You can take the massage, full body massage. You can do the Nasya, Anutaila Nasya. So that all the treatment is for basically Dhatukshayjanya Vata Prakop. Now you put that cloth bandage and your headache, in spite of relieving, it is increasing. It indicates that there is obstruction inside and it is increasing. So that is a Margavarodhajanya Vata Prakop. In these cases, you have to take some treatment which will make your digestion very properly. So in that case, you can try for Sutshekar tablet, or you can try, for example, Triphala Ghanavati at the bedtime regularly for 1 month or so. So that can reduce your ama. Even you can take the Gasex tablet, which will make your stomach a little bit light. So all these things are for the Margavarodhajanya Vata Prakop. So this is very interesting tip that I wanted to give you in the beginning. Anyways, I'm very thankful all the time for you, but don't forget to subscribe my YouTube channel and press the bell button icon to get the notifications. My dear friends, I am very much obliged by your love and cooperation and the comments and supporting my all the activities by your enthusiastic comments. So thank you very much. Take care and see you soon.